We often think of the shoulder as just a single joint, but when we're studying anatomy and when we look at it a little bit closer, there are actually 4 joints that make up the shoulder joint. So we call it, more correctly, the shoulder complex. Now, the clavicle is part of 2 of those 4 joints, so it is very much part of the shoulder. Let's just back up a bit. It sits anteriorly and makes up the pectoral girdle, as we said in the last video, with the scapula. And we can see that here in these 2 photos. The first one here is an anterior aspect, and our next photo up here is a posterior-inferior aspect. So as you can see, we are posterior, but we're also inferior. So we're sort of looking up, and we can see that inferior surface of the clavicle. So we can see the pectoral girdle from a few different angles here. Clavicle, key player. So proximally, where the clavicle articulates with the sternum, that is the only physical solid attachment point of the entire appendicular skeleton in the upper limb attaching to the axial skeleton. That's the only fixed point. So this articulation between the clavicle and the sternum is incredibly strong. You never hear about, you probably don't even know about this joint, and that's because it's never injured. It's so strong. In fact, the clavicle almost always breaks, or the joint down the other end, the lateral or distal joint, that will break long before this proximal articulation between the clavicle and the sternum. So moving laterally, we can see here that the clavicle articulates with the scapula, with this funny bit out here, and we'll talk about that when we talk about the scapula. This is a little bit of a different articulation. There's a lot more movement there. And in fact, if you just quickly pop your hand on your shoulder and roll your shoulder around, you can feel that joint and you can feel the movement that's occurring. So here is the clavicle in isolation. We can see that the bone has a really interesting shape. It's sort of famous for this shape. It's got a little bit of an S shape to it. Now, first, we just need to got a little bit ahead of myself. We need to orient ourselves. So we're looking at the left side, so it's a left clavicle, and we're looking at the inferior aspect, and that's because there's not a hell of a lot going on the superior aspect, because as you can sort of feel, it's very close to the skin, and you can sort of tell there's not a hell of a lot going on there. But beneath the clavicle, on the inferior surface, there's all sorts of things attaching to it. So we're having a look at this aspect of it right now. And we can see here, or just to get us oriented, this is lateral, this side here, and this side is medial. So medial or proximal, lateral or distal. A few things we just want to point out here. We have the acromial facet laterally, and then the sternal facet medially. Now, that makes sense. Those facets were named because of the bones or the parts of the bones that they're articulating with. The sternum, sternal facet, makes sense, and then the acromial facet. Now, you might think that it could be called something like the scapulofacet or something like that, but the acromion is a part of the scapula. We'll learn that in a second. So it's called the acromial facet. And remember that a facet is just a fairly flat surface. The other thing we're going to point out here is the trapezoid line. So that's this area here. Now that is going to be an attachment site for a ligament that is named the trapezoid ligament. So that's all we're going to point out on the clavicle. Now we're just going to look at these joints once more time and give you their full names. So the sternoclavicular articulation between the clavicle and the sternum. That's the proximal name for that articulation there, or joint. And then laterally, we have the acromioclavicular joint, or articulation. And that's the clavicle.